Hi, my name is Nina Shah from the University of California, San Francisco, and today we're at the American Society of Clinical Oncology Conference, the annual meeting, and there are several myeloma abstracts that are being discussed, of which I'm discussing 3, and it shows some exciting data, things that we need to know in our field. One of the abstracts is looking at BION 1301, which is an anti-APRIL antibody which was studied in relapsed and refractory multiple myeloma patients. This was to affect the BCMA-APRIL axis because this has been shown to be something that's of interest in myeloma targeting. Interestingly, all the patients were very relapsed and refractory and tolerated the drug fairly well, but unfortunately there were no objective responses, and therefore this program isn't going forward. And I think it's important because it tells us that BCMA is a good target, but as a target, identifying target, but not as necessarily an axis to tackle for myeloma. One of the other abstracts that we're seeing here is another CAR T-cell therapy, and funnily enough, we've seen so many of them, whereas a few years ago we didn't see so many, but this one showed 100% overall response rate. What's interesting is 4 patients had previously received CAR therapy, but with a mouse CAR, and this was a humanized CAR. So I think that talks a lot about what we can do for retreatment. Finally, there's some real-world data with selinexor and dexamethasone comparing the overall survival of that drug with dexamethasone versus real-world data in a similar refractory population or triple-class refractory population, showing that there was a significant improvement in comparison over 10 months versus 5 months for patients that would have been treated with selinexor, not treated with selinexor. And so these are sort of interesting data to show us when we don't have randomized controlled trials of what's going on with new drugs. All of this has to be taken into consideration, that this was a retrospective study and there's still more work to do. But it's exciting to see these new studies and also to know that we're moving the field forward slowly but surely.